Cystic mesothelioma is a rare tumor that forms in the mesothelial tissues of organs like the lungs, abdomen, or heart. While it is considered a low-grade malignancy, cystic mesothelioma can continue to grow over time and in some cases may progress to a more advanced cancer. Radiation therapy is sometimes used as a treatment option, either alone or combined with surgery, to control symptoms and slow the growth of the tumor. Like any cancer treatment, radiation therapy does carry some risks of long-term side effects. One of the most common long-term effects is fibrosis or scarring of the treated tissues. Radiation works by damaging the DNA of cancer cells to stop their growth and division. However, it can also affect normal cells near the treatment area. Over months to years after radiation, the irradiated tissues may develop increased scarring as the body tries to repair the damage done by the radiation. This can lead to thickening or stiffening of the skin, lungs, heart, or abdominal organs depending on where the radiation was delivered. In severe cases, significant fibrosis can limit organ function or mobility. However, most patients experience only mild to moderate levels of fibrosis that do not seriously impact quality of life. Another concern is the potential risk of developing a secondary cancer years later as a result of the radiation exposure. Each exposure to radiation, even in small doses from treatment, carries a slight risk of DNA damage contributing to the development of a new and unrelated cancer over time. The risk is small, usually less than 1% at 10 years, but it persists throughout the lifetime. Secondary cancers are most likely to develop close to the treated area within the radiation field. Cancers of the lung, esophagus or breast are of particular concern for patients receiving chest radiation. Regular clinical exams and screening tests are recommended to monitor for any secondary cancers. Radiation can also have long-term effects on specific organs systems. For cystic mesothelioma patients receiving chest radiation, there are risks of developing chronic lung issues like fibrosis, pneumonia, pulmonary edema or conditions causing shortness of breath. Heart tissue is also very sensitive. Pericardial fibrosis and scarring of the pericardium after chest radiation may lead to constrictive pericarditis and heart failure over years. Abdominal or pelvic radiation greatly increases long-term risks of gastrointestinal problems including diarrhea, bowel obstruction, stricture, malabsorption and nutritional deficiencies due to intestinal damage. Other organ toxicities such as kidney or liver dysfunction are also possible depending on the treatment area. Some patients may develop neurological effects due to radiation delivered near the spinal cord or brain. These include risks of myelopathy, necrosis of the spinal cord, cognitive impairment, memory loss, seizures or other brain injury. Radiation can also negatively impact bone health with higher long-term risks of fracture near the treatment site from osteoradionecrosis or osteopenia caused by radiation-induced bone damage over decades. Furthermore, radiation to hormone-producing organs like the ovaries or testicles increases risks of long-term infertility and premature menopause or andropause. With newer radiation techniques aimed at limiting exposure to surrounding normal tissues, these risks have become somewhat lower than in past decades. However, long-term follow-up still demonstrates cancer survivors are at higher risk for various health issues later in life as a result of their cancer treatment with radiation. Overall risk-benefit must be carefully weighed, and long-term symptom management and screening are important parts of follow-up care for cystic mesothelioma patients choosing radiation therapy. While radiation remains an effective option for many, awareness of potential long-term toxicity is important for fully informed decision-making and surveillance going forward. Radiation therapy, while useful for treating symptoms and controlling cystic mesothelioma tumor growth, carries various risks of long-term side effects impacting multiple organ systems that can persist over decades after treatment. Close monitoring and individualized follow-up care plans focused on prevention, early detection and treatment of late effects are critical aspects of clinical management for these patients.